Hello and welcome back to the Hour Show with more of Ahuva Gamliel.
Yes!
Yes! So Ahuva, we left it where we were talking about the importance of what you eat, shoes you wear, I mean, just everything is important, and how you should detox your body first before you have it work to the optimum level. And one other thing that you do that makes you so special is that you work with homeopathic anti-inflammatory that is just not used by a lot of doctors.
Right, it's not conventional, but it's very effective.
It is not conventional, very effective, and natural.
Yes.
So tell me more about that.
Well, homeopathic injection therapy is a relatively new application of natural medicine. What we do is we use the trigger points in the body and inject the homeopathic medicine right into the muscle, and it has an anti-inflammatory...
Is it painful?
You know what? I have a very special technique. Let me tell you. I use a distraction technique. So if I am going to go inject in a certain area, I scratch right next to the area, and then you feel the scratching and you don't feel the needle.
Oh, that's good.
Yeah.
Okay, so the right when you, now I know it. Now for me it's gonna hurt because the minute I will feel the scratching, I'm like,
you don't
oh,
feel
that's it, it's coming.
You see, because our brain, we have different kinds of receptors. We have scratch receptors and we have pain receptors. Okay. So once I activate the scratch receptors, then it cancels the pain receptors.
Oh, that's good to know.
Yeah.
Oh, I love it.
I have good techniques. People tell me, what, it's already in? You're kidding me. Yeah.
Okay, so you're the one that used that technique.
Yes.
So tell me more.
Okay, so it's great for people, yes. It could be for acute pain or chronic pain. Okay. Acute pain means accidents, trauma. If somebody falls and injures themselves, it could be an automobile accident. They have severe pain. It's a wonderful alternative to corticosteroids because unlike the conventional medicine, which is only putting a Band-Aid over the symptom, this holistic medicine actually helps the body to heal from the inside out. And when you do that, a person's vitality is improved. And not only that, but if you take before and after pictures using thermography, you can see before the area is red where there's inflammation. 20 minutes after the injection, it's blue.
Wow.
And it's important for your viewers to know that these medicines are FDA approved. So that means it's recognized to be effective and safe.
Yes.
And it's in the PDR, which is the physician's desk reference, so it's available to all doctors. Okay,
so all doctors, you can just,
most conventional doctors don't know about it, or they don't believe in it, or, you know, there's a deeply entrenched relationship between the pharmaceutical companies and the doctors, and so doctors would rather do things that pay better sometimes. That's part of the reason why I didn't go into conventional medicine, is that I felt like it was more profit-driven as opposed to patient-driven. And here I get to custom tailor solutions to each individual. Even though I do accept many PPO insurances, because I'm not with HMO insurances, they can't dictate to me how I'm going to practice medicine. So I could give each person the best choices for themselves.
I'm so happy to have met you.
Thank you.
I need you. So how to get in contact with you?
The best way is either on my website, which is drgamliel.com, or to call 786-537-0771. And it's very easy to book an appointment.
Great. One more thing I would love to talk about is acupuncture and cosmetic.
Yes.
It's used now more and more to lift your face, to tighten your pores. So tell me more, because I know you do use acupuncture.
Yes. Acupuncture is excellent for facial rejuvenation. It's a nice, again, safe alternative to Botox and other of the conventional facelift procedures. There's no side effects. You only get side benefits, such as improved sleep, better balance, you have more energy, and it does, just like you said, it helps the body synthesize more collagen and elastin, which naturally slows down with aging. And it's an anti-gravity effect. It does tighten everything and lift it up. Not only does it lift up your skin, but it lifts up your spirit.
Wow.
So you can also, acupuncture secretes serotonin from the brain, which is a neurotransmitter that's responsible for feelings of well-being. So it's a natural antidepressant. Yeah.
That's great. So you got those needles.
Yes.
All right, so what are we going to do with those?
Okay, so these are acupuncture needles. As you can see, they're very fine. It's like the breadth of a hair.
Yes.
It's nothing like the needles that are used to draw blood from the arm. And they come in individualized packages. It's sterile, and they're not used on anyone else except for you, and then they're thrown away.
Okay.
And what we do is we put them on different points in the body to have different therapeutic benefits.
Okay.
And we discussed earlier headaches and pain.
Yes.
And the common point for doing that is right here in the web between the index finger and the thumb.
Any hand? I mean,
either hand, yeah.
Okay.
Sometimes if somebody has, let's say, more of a left-sided pain, then we could use the left hand. But I like to treat symmetrically,
yes,
because sometimes the side of the pain is not the side of the problem.
Right.
You know, so we have to treat both sides.
Okay.
Even though the symptoms may not be manifesting on the other side, we want to have balance.
Sure.
Yeah.
Prevent. Okay.
Yeah, so
Great.
we wanted to do a little demonstration because another frequently asked question is, does it hurt?
Yes.
And I tell people it feels like a mosquito bite. You feel like a little tiny little prick, but then any discomfort subsides. And then once the needle's in, it's normal to feel a dull, heavy achiness or a pressure sensation. That means that it's working. That's your chi, or your vital energy.
The energy.
Yes.
It's being lifted.
Yes.
That's great.
Okay, so can we get a close-up on Ahuva's hand so we can show this? So just relax your hand on your knee.
Okay.
Yeah. Okay. So as you can see, this is a little guide tube. And what I do is I put the needle through the guide tube, and then I just tap it in very gently. Just leave your hand right there and relax it. So I just bring it right here and then tap. And that's it.
That's it?
Easy? No screaming,
No, it doesn't hurt at all. I was waiting to see, okay, oh, I can feel good now. Oh, I feel it.
Yeah, usually we leave them in for half an hour.
Okay.
And then at the end of the half an hour, we remove all the needles, and the person has, you could see on their face how relaxed they are. And they leave feeling they're in a different state. You know, our brain has different wavelengths. There's alpha, beta, gamma, and theta.
Yes.
And there's the waves of relaxation are very close to the waves of sleep. So when you have acupuncture,
So if I fall asleep, it's her fault.
Yes. So actually, some people fall asleep during the treatment and even start snoring, you know, because they're so
That's
deeply
great.
asleep. And when you sleep is when your body heals itself and rejuvenates and replenishes. So,
That's right.
So it's wonderful all around. It's a win-win.
And you are wonderful.
Thank you.
Thank you so much.
My
Keep
pleasure.
up with the good work
Thank you.
and come back and visit us.
Pleasure.
Well, I have something for you.
Oh, let me take out your needle.
You can leave it? Oh, that's it?
Yeah, that's it.
Oh.
You want to take it out?
That was great.
Okay, good.
So this is for you.
Thank you
To
so
say
much.
thank you for the good work and keep it up.
Wow,
And
thank you.
I have here, this is one thing I added to the show, is my thought box.
Oh.
We all have good thoughts that support our life, or I would not say bad ones, just ones that are not supporting our life to just grow and go forward. So here in this box, I just mix them. So you pick one.
Oh boy. Good thoughts, good thoughts. Come on.
Good thoughts.
Should I read
Well,
it out loud?
the good one, you don't have to work on them anymore.
Okay.
The other ones are the one you should worry about.
Okay. Should I read it out loud? Okay.
Yes. Go ahead.
There is no one to help me. I am all alone.
Is that one of a thought that you might have sometimes? Or used to have?
I am a very independent person, and so I do feel like I have to do everything in order to make it happen.
You
Yes.
believe that?
Maybe somewhere I do.
You do.
Yeah.
Who are you with that belief?
I feel that by allowing other people to help you, it's really enables you to get where you want to go. So it's very important to be able to ask for help when you need it.
Yeah.
Yes. And yes. So even as a healer, I need to be healed sometimes. And I do have practitioners who I do trades with. So It's a good reminder.
So that's beautiful. So this is, there is no one to help me. I'm all alone. So you're not alone. And having that thought does not serve you. Because anytime you have it, all you do is reject people and you think you're the only one that can do everything for yourself. And who are we with this thought? We are lonely.
Thank you for that.
Thank you. That was the thought of the day. So if you have that thought, say just thank you, but you're not serving me anymore. You're not alone. We're all in here with you. Together.
Amen.
And remember to be loving to yourself.
Thank you.
Honey.
Pleasure. Thank you.
Thank you.